It's a great day at Vitality Chiropractic. This is Nick speaking. How may I help you?
Hi, my name is Rachel Woods, and I'm interested in becoming a patient at your chiropractic office.
Oh, awesome, Rachel. It's a pleasure to meet you. What is the best number to reach you at?
419-555-5555.
Perfect. And how did you hear about us?
Actually, one of my friends is a patient there. Her name is Michelle Sims.
Oh, Michelle. We love Michelle. She rocks. That's so cool. So this appointment's for you and how many members of your family, Rachel?
It's just for me.
Just for you? Okay. And does earlier in the week or later in the week work best for you?
I don't really have a preference.
Okay. What about mornings or afternoons?
Definitely mornings.
Mornings, we have an availability on Monday at 10 a.m. or 10:30, which works best for you.
Let's do 10:30.
Perfect. So I have you down for Monday at 10:30. Now, do you know where we're located?
No, I don't. I just found you online.
Okay. Well, we are on Cobb Parkway, right across from the Big Chicken. Do you know where that is?
Yeah, I do.
Perfect. Perfect. Well, we will see you on Monday at 10:30, and we look forward to serving you then.
Thank you. I'll see you then.
Thank you. Hey, Rachel. Nice to meet you. My name is Dr. Nick Shelby.
Hi. Nice to finally meet you.
Nice to finally meet you. Can I have a copy of your driver's license and your insurance card, please?
Yeah, sure.
Excellent. I'll take these. And then this is some new patient paperwork for you to fill out for me real quick. Just go ahead and do that and let me know when you're done, and we'll get you going, okay?
Okay.
Excellent. Thank you. Let me just check through this real quick. Make sure we have everything. Excellent. All right, Rachel, I'm going to go ahead and set this aside for now. And what we're going to do is I'm going to give you a quick tour of the office. That way you know where everything is, okay? Awesome. So right up here at the front desk, we have our sign-in station. And so as a practice member at Vitality Chiropractic, you're going to get a Vitality Chiropractic health card. And what you do is every time you come to the office, you'll just swipe it right here.
Cool.
Yep, and it just lets the team know that you're here so we can expedite your care for you, okay?
Okay.
Cool. Up next, we have the subluxation poster, okay? So, Rachel, as principled chiropractors, we get to the root cause of your health concerns by finding what we call in science a subluxation, okay? A subluxation is when one or more of these bones in your spine misalign, and it puts pressure on those nerves that are coming out right there.
Mm-hmm.
And that often results in a lot of the aches, pains, and dysfunctions that a lot of people experience on a daily basis. Does that make sense?
Yeah.
So if you think about it, if we have a misalignment right here in your lower back, that can pinch off the nerves that are going to your digestive tract, your reproductive organs. And a misalignment there, could lead to things such as infertility issues, irregular menstrual cycles, constipation, irritable bowels, things like that.
Wow.
Yeah, pretty crazy, right?
Yeah, it is. Never knew that.
Right. So, but if you go up a little bit to the mid back, if you have a misalignment here, it could pinch the nerves that go to your heart and lungs, right?
Oh, wow.
So a misalignment here could result in different things like asthma, high or low blood pressure, heart arrhythmias, things like that.
Okay. Wow.
And then if you go up to the top in your neck, if you have a misalignment here, it could pinch the nerves that are going to your eyes, your ears, nose, throat, sinuses, things like that. And so if you have a misalignment here, it could lead to things like chronic ear and eye infections, sinus infections, allergies.
Could it be when I'm having headaches all the time?
It could be the reason why you're having headaches.
Okay.
Yep.
No.
Pretty wild, right?
That is crazy.
Yeah, so does that all make sense?
Yeah, absolutely.
Okay, cool. So then right over here, we have our assessment room, okay? Now, in here, we have some state-of-the-art technology that was developed by NASA that allows us to get an exact assessment on how well your nervous system is functioning.
Okay.
Pretty cool, right?
Yeah.
Yep. So we'll be able to get into that later, but next we have our family wall, okay? So at Vitality Chiropractic, we see a lot of families, and we actually specialize in pediatrics and pregnant mothers.
Oh, wow.
I know.
Very
I
cool.
love it. Absolutely love it. But what we find in our office is that mothers who come in for care before, during, and after their pregnancy experience a much more comfortable pregnancy. And not only for them, but also for the baby as well. And a lot of the moms will actually bring in their newborns days, if not hours, after the baby's born so that they can get checked for nerve interference.
When they're like little, like newborns.
Little buddies, just
Oh
like
my
this.
gosh.
I know, right? But they understand the importance of having a child to grow up without any kind of nervous system interference.
Okay.
Does that all make sense?
Yeah.
Perfect. And so then right over here, we have our adjusting room. Okay, so as you can see up top, they're numbered 1 through 4. And at the front desk, when you come in and you swipe your card, it'll call you back to one of these rooms.
Oh, cool.
Yeah, so all you'll do is you'll just empty your pockets, place everything on the table. There will be a couple questions for you to answer on the computer. And we just ask that you lay face down on the table, take a couple deep breaths, relax, and the doctor will then be in for your adjustment.
Okay.
Sound good?
Yeah.
Perfect. And then right over here, this is these are our chiropractic success stories. We see a lot of conditions coming through our office, anything from ADHD and asthma all the way to infertility issues and irritable bowel syndrome, right? So we see a lot of people come into our office for different things. Now, we know that you know people who are suffering from these kinds of conditions who could benefit from chiropractic care. So right here, there will always be a voucher for a complimentary evaluation that you can give them so that you can pass on the blessing of health and healing to them as well.
Very cool.
Awesome, awesome. So feel free to take that and give it to whoever you feel could benefit from that.
Okay.
Cool. And then right over here, this is our history hallway. Okay, this will tell you a little bit about chiropractic history. So this man right here, his name was D.D. Palmer. He was actually the founder of chiropractic. He created it in 1895. And the man next to him is his son, Dr. B.J. Palmer. And Dr. B.J. Palmer was the man who really took chiropractic and developed it to what it is today.
Okay.
Right? And this man right here next to him, his name is Harvey Lillard. Okay? He's actually the first chiropractic patient ever. Okay? And at some point in Harvey's life, he actually lost his hearing. And 17 years after that, he met Dr. D.D. Palmer. They were working in the same building. And he let Dr. D.D. Examine him, try to figure out what exactly was going on. And D.D. found a misalignment in his back. And he asked Harvey if he could correct it, and he did. And instantly, Harvey's hearing was restored.
Wow.
Right, and that's how the chiropractic profession was created out of that. And fast forward 100 years later, we're the largest drugless healthcare profession in the world, based on the understanding that health comes from the inside out, not the outside in.
Okay.
Make sense?
Yeah.
Perfect. And if we walk right up here, this is our water fountain. We always recommend that you stay hydrated, especially after you get adjusted. It just allows your tissues to repair a lot more quickly when they're hydrated.
Okay.
Cool. And then right next to it is the restroom for your convenience. And then right over here, we have our evaluation room. And this is actually the end of our tour. So you can go ahead and have a seat right here. And I'm going to give you this brochure. Just go ahead and look through it for a couple minutes. It's going to go over a little bit about chiropractic, what health is, and how chiropractic can restore function to your body. Okay?
Okay. Thank you.
Perfect. Thank you so much. Hi Rachel, good to see you again.
Good to see you, Nick.
Did you enjoy your tour?
I did.
Awesome, awesome. So what we're going to do real quick is we're going to go over some of your paperwork, some of your health concerns that are going on. We're going to talk a little bit about those, okay?
Okay.
Cool. So it says here that you've been having headaches for a while. How long has that been going on?
About 5 years.
Really?
Mm-hmm.
Okay. And how often does that happen?
At least 2 to 3 times a week.
Okay. Wow. So that's a lot of headaches that you're experiencing.
Mm-hmm.
Okay. What about the irritable bowels? What's going on with that?
Been experiencing it since after college, like 2 years.
Okay. Cool. And how often do you experience an episode of that?
Every other week, so
Okay.
twice a month probably.
Okay. Cool. And do you do anything for that when you get that? Do you take a prescription? Do you...
I kind of let it be.
Okay. Gotcha. Was there anything else that you wanted to mention or say before we move on?
Nope, that's it.
Okay, cool. So what I'm going to do then is I'm going to set this aside, and we're going to have a little talk on chiropractic health and healing and how chiropractic restores function. Okay?
Okay.
Cool. So now there's something inside every single living thing on this earth, right? It's you, it's in me, it's in the birds, it's in the trees. It's in everything, and it helps to keep us alive without us having to think about it, right? Tells your heart to beat, your lungs to breathe, your food to digest, does everything. Now, some people would call that the spirit or the energy of the body, but in science we call that the innate intelligence of the body. Okay?
Gotcha.
Now, innate means inborn. So what happened was when you were growing inside of your mom's tummy, the first organ system that developed was your brain and your spinal cord. Okay?
Okay.
Now, this is where your innate intelligence lives. Does that make sense?
Yeah.
Perfect. So, we're going to take a little look at the spine real quick. So, up here, Rachel, you would have your brain,
Okay.
right? This is the base of your skull. Do you see this hole right here?
Yeah.
Okay. That's called the foramen magnum. Now, that translates from Latin into literally big hole. Okay?
Okay.
So, what happens is that your brain sits up here, and it sends down a spinal cord through that foramen magnum all the way down your spine to your tailbone.
Okay.
Right? And so what these nerves do, and these are your spinal cord, and these are the nerves, right, that shoot off of it.
Okay.
So what your brain does is it sends specific signals from the very top all the way down your spinal cord, out through these nerves into different parts of the body, right? So every tissue, cell, organ, everything is communicated to through these nerves from the brain. Does that make sense?
Yeah.
Cool. So in science, we call this the above, down, inside out principle, or the ADIO principle, because health and life literally flows from above, down, inside out. Does that make sense?
Yep.
Perfect. So then, Rach, what can happen is that one or more of these bones in the spine can misalign, and it can put pressure on these nerves. It can become irritated and inflamed, and as a result, your brain can't send the right signals out through that nerve where it needs to go, right? So think of it almost like a garden hose. So if you're holding a garden hose right here, you turn on the water, and there's water shooting out, right? But then you kink it. What happens to the water?
It stops.
Exactly. So your nervous system kind of works the same way. When there's a kink in the spine, it's like having a kink in the hose to where instead of the water not being able to go out, the right messages aren't able to go out, right? So if you have a misalignment in your spine, let's say for instance the lower back, do you think you're going to have normal function or abnormal function in your lower back?
Abnormal.
Exactly. So if you were to have a misalignment down here and it's pinching these nerves, that could lead to things like irritable bowels, infertility issues, irregular menstrual cycle, constipation, diarrhea, things like that.
Okay.
Right? But if we go up to here then, and these nerves in your mid-back, if these are pinched off, these are the nerves that go to your heart and lungs. So that could result in higher low blood pressure, heart arrhythmias, asthma, things like that.
Oh,
yeah, pretty wild, right? So then if you move up to the top of the neck, right here, these are the nerves that go to your ears, eyes, throat, and sinuses, right? So a misalignment up here that pinches those nerves, you could get chronic ear and eye infections, sinus infections, allergies, and stuff like that. Does that make sense?
Yeah.
Perfect. So then, usually what people want to know, and I'm sure you're probably wondering this too, is, well, how do these happen?
Yeah.
Right? Where do these
come from?
Exactly. So there are two ways that we get them, two main ways. Big traumas and little traumas, right? So big traumas we're all really familiar with. If you were to slip and fall, a car accident, something like that, like some big traumatic event, right? But the second one is actually more dangerous, the micro traumas. It's the daily repetitive things that we do that we don't even realize that over time takes a toll on our spine, right? So looking down on our phones while we're texting, sitting at a desk all day, leaning over, for some people they're driving a car all day, which then again they're hunching over or picking things up and setting them down, right? Over time, that wear and tear, without the proper structure, can lead to degeneration, misalignments, and things like that. Okay. Make sense?
Yeah.
Cool. So then, Rachel, the last thing that we want to talk about is healthcare in America right now. Okay? Healthcare in America right now takes an outside-in approach as opposed to an inside-out approach when it comes to healthcare, right?
Right.
So if you were to go to the doctor and you were to tell them that you had irritable bowels, what do you think they'd do?
They would probably give me some liquid form of medicine.
Exactly. You would get some form of medicine, and that would be it, right? So whether it was drugs, surgery, radiation, whatever, they're taking an outside-in approach to cover up the symptoms and not truly get rid of the cause, right?
Mm-hmm.
So it's like if you're driving one day and your check engine light came on, and you said, "Oh, interesting," and you took a piece of black tape and you just put it over the light so you didn't see it, right? But that doesn't actually fix the engine. It just covers up the sign, right? So what we do in chiropractic is we locate the root cause of that health concern or why that engine isn't functioning, and we correct it using specific gentle adjustments.
Okay.
Does that make sense?
Mm-hmm.
So when we do that, and we realign these bones and we take this pressure off these nerves, it then allows your brain to send the right messages out to that part of the body, which then restores function, right?
Mm-hmm.
And what is health? 100% health is 100% function,
Okay.
right?
Mm-hmm.
And so that's what we're shooting for. So does that all make sense?
Yeah.
Perfect. So are you ready to get to the root cause of your health concerns?
Yes, I am.
Perfect. So then what we're going to do next is we're going to do your neurological evaluation. That way we can get a good idea of how well everything is functioning in your spine, okay?
Mm-hmm.
So that's going to be $75 with your insurance. Are you ready to go ahead and move forward with that today?
Yeah, that's fine.
Perfect.
Mm-hmm.
So I'm going to go ahead and step outside, go ahead and put this gown on, take off your shirt, unstrap your bra in the back, leave your pants on and everything like that, and I'll come back in, we'll get you scanned, okay?
Okay.
Perfect. Alrighty, Rachel. So we just did your neurological assessment, and so now we're going to talk about the findings and what we saw. Okay. So this is your neurological assessment.
There's a lot of red on there.
Yeah. Yep. So you're already on the right track. So what we're looking for is we're looking for colors, right? So green would be a mild amount of interference, blue is moderate, and red is severe.
Okay.
Right? So tell me what you see here.
A little bit of everything.
You got the whole rainbow going on,
Yeah.
right? So up in the top of your neck, you have some red right here on the right side. A little bit of blue underneath that, some blue in the upper to mid back, but then you have a lot of red and blue in your lower back as well, right? Excuse me. So let's connect some dots real quick, right? So you said you've been having headaches.
Yeah.
Right?
Mm-hmm.
So this top bone right here is called your atlas, right? And this is the most important bone in your entire spine because there's over 70 trillion nerve fibers that flow through that one bone.
Wow.
Right? So if you have an atlas that's shifted the wrong way or slightly turned or something like that, and your brain isn't able to send the right messages to your body, and your body then can't send the right messages back to your brain, do you think that could cause some dysfunction up here? Do you think that might have anything to do with your headaches?
Absolutely.
Cool. And so then down here, you're also talking about irritable bowels. Well, these nerves with the red right here, those are the nerves that go to your large intestine, right? So if you're not getting the right nerve flow or the right messages that are being sent out to your colon, do you think that could possibly have something to do with your irritable bowels?
I do, yeah.
Okay, cool. So any questions on this?
No.
Perfect. So, Rachel, when I see a scan like this with someone who has the same symptoms that you do, that tells me that they're usually the perfect candidate for neurologically based chiropractic care. Okay? So what we want to do now is we want to schedule you for your most important appointment you'll ever have in this office. Okay? It's the principal doctor's report, where we're going to go over health and healing from A to Z, and you'll be able to then meet with the doctor. We'll go over his report of findings, tell you what he found, what he recommends, all the financial questions, everything like that will be handled that night. But more importantly, you're going to get your first adjustment, right? Which is what we want.
Yeah.
So we have 2 times that we offer the principal doctor's report. It's either at Thursday at 7 or Tuesday at 1. Which one works better for you?
7 a.m. or p.m.?
PM.
That one will work.
Okay. Tuesday at 7?
Mm-hmm.
Perfect. So let me write you down real quick for Tuesday at 7. Now, Rachel, it's very important that you bring your spouse or loved one with you. Okay? I know I wouldn't make any financial or healthcare decisions without my loved one with me, and I would hate for you to do the same. So, very important that you bring him with you. You can turn it into a date night, whatever. We're also going to offer free childcare.
Oh, wow.
Right, yep.
Okay.
So bring the kids. You won't have to worry about finding a sitter or anything like that. And we'll be able to take care of them for you. Okay?
Very cool.
Any questions on that?
Mm-mm.
Perfect. So then now what we want to do is we need to take some specific chiropractic postural x-rays so we can see exactly what the structure is of your spine now that we know what the function is.
Okay.
Okay?
Mm-hmm.
So with your insurance, your deductible hasn't been met yet. So the x-rays are going to be $250 out of pocket.
Okay. It's worth it.
Yes, it is worth it. But what we're going to do is we're actually going to enroll you into our federal discount program, which allows us to legally discount those x-rays to cheaper than what your insurance is.
Okay.
So they're actually going to be $150.
Oh, nice.
Yeah.
Okay.
Yep. So, so for your x-rays and the neurological assessment we just did, it's going to be $225 today.
Okay.
Okay. So go ahead and pull out however you want to pay for that, and we'll get you going. Thank you. Alrighty, Rachel, good to see you again.
Nice to see you.
How did you like the doctor's report?
It was very interesting. I
Yeah.
learned a lot.
Good. That's always the goal. Do you have any questions on anything we went over?
Nope, it was super informative.
Perfect. So then what we're going to do now is we're going to go over your x-rays. We're going to take a look at what's going on structurally. And then we're going to talk about my recommendations and where we go from there, okay?
Okay.
Perfect. So right here, we have a picture of your low back and your pelvis.
That's me?
Yep, that's you. So what we want to see, ideally, is we want to see that your hips are level and that your spine is straight. Okay, that's what we want. So as you can see right here, your right hip is actually a little bit higher than your left.
Okay.
Right?
Yeah, it is.
So when you do that, the rest of your spine then has to compensate for that movement, right? So if you see right here, the bones in your spine or your vertebrae are actually rotated to the left.
Oh, yeah.
Right?
Wow.
So if you look at this, if we raise this right up a little bit, do you see how this naturally wants to rotate over that way?
Yeah.
To compensate? So that's what's going on. Does that make sense?
Yeah.
What we want and what we have? Okay, perfect. So now we're going to take a look at the pictures of your neck. So this is a picture, or your x-ray of your neck.
Right.
So what we want to see, well actually, this is what we're looking at first. Your brain is up here, your skull, and then these are the bones in your neck, all 7 of them. And this is the atlas that I was talking about earlier, the most important one. These right here are called your spinous processes, the little things that shoot off the back of these bones.
Oh, okay.
Right? So, ideally, what we want to see is you see this red line? We want to see the bones move in that curve.
Oh, wow, I'm way off.
So we have a straight neck right here. We have a loss of the cervical curve, what we call that. Then also, we want to see some good space in between the vertebrae. And we call that disc space, right? As you can see, there are kind of these gelatinous discs right here.
Yeah.
So that's what these black spaces are right here. So you see how there's a nice space right here and right here and right here?
Yeah.
But then you get down here and it's a little crowded.
Yeah.
Right? So that tells me that there's a little bit of disc degeneration beginning right there, right? So if you look up here at the degeneration chart, phase 1 is normal, right? That's what you have going on in the top part of your neck, where you have healthy disc space and everything. But in phase 2, you start to see them, they get a little bit closer, the bones aren't as smooth at the end plates, and that's what we're beginning to see right here.
Okay.
Right? Does that all make sense?
Yeah.
So where we want it to be and where it is now? Okay, cool. So, any questions on that?
Nope.
Perfect. So now, what we want to do is we want to go over your roadmap to optimal health and healing. Okay, these are my recommendations to correct those issues, to restore proper structure.
Mm-hmm.
Because what comes when you have proper structure?
Proper function.
Proper function. And what happens when you have proper function?
100% health.
You got it. You got it. So, what we're looking at, what I'm recommending is 68 visits over a 12-month period.
Okay.
Okay?
Wow.
So that's going to start off at 3 times per week for the first 4 weeks, 2 times per week for the next 12 weeks, and then just 1 time a week for the last 32 weeks.
Okay.
Okay? So that's going to be 48 weeks total, not a whole year. But what we're including in that's not included in this, are the 3 reassessments with the neurological equipment that we did.
Okay.
Right? So that way we can see how well you're tracking along, how well you're progressing, and things like that. Make sense?
Mm-hmm.
Perfect.
Nice.
Yeah. Yep. So, Rachel, every visit should take about 10 minutes or less. Okay? Our goal is to get you in here, to get you adjusted, to get you functioning better, and then to get you back to your personal responsibilities in life. I know we all have things going on, and I know I hate personally when I go to a doctor's office and I sit there for an hour and I just sit there.
Yeah.
And I sit there, right? So we don't want to do that. We want to make sure that you get what you came to get, and then you're free to do what you need to do.
Sounds good to
Right?
me.
That's our goal. So, so with all that, there are 2 ways that we can go about this, right? What most of our patients do is they pay in full. Okay? They pay everything up front, and that's $1,917.
Okay. For
Okay.
the entire year?
Yes.
Okay.
Yep. So for all 68 visits, that's for that. Now, when you do pay in full, you do get a 15% discount on what it would be if you were to pay monthly,
Mm-hmm.
right? So that's why a lot of our practice members like to pay in full, because 1, they're getting the discount, and 2, they understand the value of having a proper functioning body,
Mm-hmm.
and so they just want to get it out of the way right then and there.
Okay.
Make sense?
Mm-hmm.
Perfect. So I know that may not be possible for everyone, and we understand that. So we also have a monthly option. Okay?
Yeah.
So the monthly would be $170 a month.
Mm-hmm.
Now that is not a discounted price, so you would be paying the full price as opposed to the discounted paying full upfront price. Does that make sense?
Yeah.
Perfect. So, just so you know, this is not a contract. This is not legally binding or anything like that. So if you decide in the middle of your care that you want to move to Hawaii, and you're just done, what we'll do is that if you paid in full, we will just reimburse you what you haven't used yet. Okay? No questions asked. We're not gonna mess around with that. Or if you decide to pay monthly and you decide to move to Hawaii, we will just then reimburse you for what hasn't been used that month.
Okay.
Make sense?
Mm-hmm.
Cool. So, Rachel, which works better for you? Pay in full or to pay monthly?
Definitely monthly.
Definitely monthly?
Mm-hmm.
Perfect. So then, next question is, would you like us to take that payment on the 5th of every month or the 20th?
The 20th.
Okay, perfect. So then what we'll do, Rachel, is we will take you up to the front desk. We're going to get you scheduled. We're going to lay out your whole schedule for you. We're going to handle the details of your payment that we're going to take out on the 20th of every month.
Mm-hmm.
And then we're going to go get you your adjustment.
Okay.
All right?
Yeah.
Good deal. We look forward to serving you, all right?
All right, thanks.
Cool. So this is the practice management binder. Basically has everything that's on Blackboard. So right here we have pre-visit, going over different things, phone calls. They're all double-sided. Right here we have the day 1 education, or the visit 1, going over the different procedures for that. And then we have the new patient orientation. office issues, conclusion. Right here we have the reported findings. All of it right there. The template, or the one that Dr. Eamon gave us. I handle different things in the office. And then there's a visit 5 and 10 section. We have a progressive exam. And then in the back are the speaking strategies that are on Blackboard as well. And there's more room to add as I go. So this is the research portion of the project. This is something that I've been developing and adding to for a long time. So I don't necessarily have a wellness care, condition care tab, but they're divided into different conditions that people might experience. And then down here we have bad medicine, VSC, functional neurology, vitalism. So I'll just go through here. A short leg, anatomical short leg, TMJ, chiropractic and stroke, an autism study, the neurology, pregnancy, scoliosis research, MS, ear infections, antibiotic use, blood pressure, spinal surgery, specifically fusion for scoliosis patients, epilepsy, the validity of thermography, different studies on the adjustment's effect on the immune system, back pain, the bad medicine, how the adjustment affects the brain, functional neurology. There are different case studies and white papers on these links, probably about 30 total, and then a couple studies on vitalism.